Hello, my name's Jerry Nolan. I'm a consultant in anaesthesia and intensive care in Bath, and I'm a member of the AIRWAYS-2 research team. I've had a long-standing interest in cardiopulmonary resuscitation, and I'm currently editor-in-chief of the journal Resuscitation. I'm here today to talk about the iGel arm of the AIRWAYS-2 trial. And before I talk about the practicalities of inserting an iGel, I thought it would be helpful just to talk to you about some of the relatively novel characteristics of this device. The iGel is one of several second generation supraglottic airway devices. These are designed to be inserted in the patient's mouth and to come in contact and form a seal with the patient's larynx. There are a variety of devices. This is perhaps one of the simpler ones because it doesn't require any air to be put in to inflate its cuff. It has a pre-formed cuff, if you like. The other features of the iGel are that it has a gastric drain tube, as you can see running down the side here and coming out the end where it will sit at the top of the esophagus, and that will drain liquid gastric contents out of the way. Of course, it will not drain more solid food and larger material. The other feature of the iGel is that it has a black line across it, as you can see there, and that's a guide to give you some idea of where that should sit in relation to the patient's incisors. So there are a variety of sizes of iGel. For the purposes of the trial, you will have access to size 3, 4 and 5, and the size 4 iGel, which is this one here, will be suitable for the vast majority of adults. The manufacturers state a recommended or guide weight range on this of 50 to 90 kilos, but in fact the patient's height is probably just as important in terms of sizing. Some relatively tall patients are likely to need size 5 iGel, and relatively short patients may well need a slightly smaller size 3 iGel. For the purposes of this demonstration, I'm not wearing gloves, but of course in practice it's extremely important to have full precautions, including gloves at all times. One of the great advantages of the supraglottic airways when it comes to cardiopulmonary resuscitation is that it's possible to insert them with chest compressions ongoing. So you should be able to insert one of these devices without interrupting chest compressions at all. So here is a new iGel in its packaging. It's important to just check the packaging to make sure that that is intact. And then you open the package. You can see immediately the iGel comes mounted on a cradle, which is the green plastic device here. That is not designed to be placed in the patient's mouth, and in fact that's part of the packaging. If you remove that to start with, and then just check the iGel at both ends, making sure that there's nothing obstructing the lumen all the way through. We can then simply get some lubricant, some simple water-soluble gel, as you can see there, which we're going to use as our lubrication. And the manufacturer recommendations are to place the lubricant on top of the cradle, as you can see there. It's important to apply water-soluble gel to the back and to the sides of the iGel, as you can see here, but make sure that you don't get water-soluble gel on the inside of the bowl and inside the airway. We can then place that down to the side, and then we can position our patient. Chest compressions will be ongoing at this point. We can extend the patient's head using the left hand, as you can see there, and then with your right hand simply put the iGel into the patient's mouth. Try and keep it well applied to the patient's palate, and then slide it down until it comes to a stop, and it's a fairly obvious stop. And if it's sitting properly, it should be sitting in the midline, and the black line that we showed earlier on should be approximately level with the patient's incisors, although I must emphasize there is some variation there, and in fact in this mannequin that line is sitting about 1 centimetre above the incisors, but that's still a perfectly reasonable location. If for any reason you have problems getting the iGel around the back of the patient's tongue, what you can do is ask an assistant to try and give you a jaw thrust. And the jaw thrust manoeuvre will often open up that airway and allow the iGel to pass very smoothly around the back, as you can see there. Once that's in position, we need to make sure that we can ventilate the patient's lungs adequately. What we're going to do is attach an end-tidal CO2 monitoring device. Now, there are a number of these available. What we're showing here for this demonstration is a simple colorimetric CO2 detector. And these will come in packets, as you can see here. We'll take that out of the packet. And you can see the initial colour here is a clear purple colour. When we connect that up to the iGel, collect our self-inflating bag, if we're getting proper ventilation of the patient's lungs, we should be able to see chest rise, and we should see an obvious colour change to either yellow or beige if we're getting end-tidal CO2 detected. And I'll say more about that in a moment. If you've got end-tidal CO2 capnography, that's even better, because waveform capnography is the ideal for making sure that you are ventilating the lungs adequately. So, as well as confirming the presence of end-tidal CO2 and looking to see that there's chest rise, we can of course also use a stethoscope to listen for air entry into the patient's chest. And we can do that by listening gently to both sides of the chest. And that sounds fine, and then somebody can get back on the chest compressions. We then need to secure our iGel, and there are two ways we can do that. The manufacturers recommend the use of self-adhesive tape, as you can see here, and you just secure it to the patient's maxilla, just like that. That's one technique. Sometimes, particularly there's a lot of secretions or vomit around, that doesn't work terribly well. So the alternative, and I'm just going to take that off just to demonstrate, the alternative is to use simple tie, as you can see here, and tie that in much the same way as one would tie a tracheal tube. There are various ways of doing it. I tend to put one throw around, like so, tie that tightly, and then just tie a bow down the side, as you can see. And again, let's emphasise, you can have chest compressions ongoing throughout the time here. And then we can go back and continue ventilating. One of the other important points to make at this stage is that once we've got the iGel in, that is basically a form of advanced airway, and we should be able to continue chest compressions without pausing for ventilations. Another important point about the use of iGels during cardiac arrest is that you will often get some leakage of gas from around the larynx. In other words, the seal with the larynx is not necessarily perfect. It's not as good as the seal that you would get with a tracheal tube inside the patient's trachea. The important thing is that you can see chest rise and that you can easily detect CO2. So even if you've got some leakage of gas coming out through the patient's mouth, you've got those two indications of adequate ventilation. It's perfectly reasonable to continue. These colorimetric CO2 devices, as we said earlier on, are designed to give you a colour change with carbon dioxide. So they'll start off a sort of purple colour when there is no CO2, and what you're expecting to see with adequate CO2 is a change to yellow, which I'll demonstrate now. And you can see that that now has gone from that sort of purpley colour to a bright yellow, which means that's pretty well normal end-tidal CO2. In cardiac arrest, because the pulmonary blood flow is relatively low, even with good CPR, the amount of CO2 generated is less than normal. So what you might see is more of a sort of beigey colour, as you can see on the device there. So I hope, in conclusion, that's given you some tips in terms of use of the iGel during cardiopulmonary resuscitation. If you want any further information about the use of the iGel or any other aspects of the AIRWAYS-2 trial, please contact the AIRWAYS-2 team. Thank you.